Yeah, good day, everybody. It's Duncan here. I'm standing as a candidate for the upcoming Northern Tablelands by-election, and we're here today with Dr. Ricardo from Uralla Medical Centre, and we're going to discuss some of the health-related issues, particularly around what's happening in Uralla, but also it seems to be across the region as far as needing more doctors to come to regional areas, and particularly highlighted in our area. So how are you, Dr. Ricardo?
Hello, good afternoon. How are you, Duncan?
Very good. So it's sad that you're leaving us. You've kept me alive for a decade. And as you know, I've had some weird and wonderful readings in my bloods and what have you over that time, and a few close calls. Too many visits to emergency. Thankfully, in the last 12 months or so, though, we've turned the health around quite a bit, and that's all looking good to the future, except that now we won't have a GP in town.
Yes. So, first of all, really thank you, Duncan. You are the only person on this planet who approached me about this problem. And what it seems that everyone denies the responsibility. No one wants to take responsibility. No one wants to talk about it. And as this is the problem of no one. So yes, I am leaving Uralla because of the crisis in the health system, and I'm leaving behind me not less than maybe 4,700 people. And from those 4,700 people, definitely 3,500 are now looking for a GP, unfortunately. Anyhow, we're not going to talk about my personal problem here.
Well, it highlights.
Exactly. It's a part of it. I guess it's a very good example. So we're going to go back to my issue here from time to time during our talk today.
Yep.
Duncan, I think with what's going on now, very quickly of course, everyone knows what's the problem is, but we need to point at some points here. That, as everybody knows, that the hospital system in Australia is run by the state government and the Medicare is run by the federal government. And those two governments keep fighting who would do what. So for us as GPs, we are funded by the federal government. And we always in contradiction when it comes to business with the hospitals. Again, you do this. No, I don't do it. You do it. It's not my job. It's your job. And the money is leaking in between those two systems, and billions of dollars are actually going down the drain without any benefit from it. We are now in this situation, and we have to look at the short-term solution and long-term solution. Of course, we can talk about the long-term solution later if we have time. And probably this will be one of your mission. If you were unlucky and you don't succeed this time, I guess you should run for next time for the official one. And this should be on the top of your schedule. You know, you will talk about it to everyone around, make everybody aware about what's going on.
Well, what I've seen just getting around the region in the last couple of weeks is it's not just us. Like, as much as it affects me directly personally, and those 3,500 people are going to, if they can't find anyone, rock up at emergency at Armidale, so they're going to soon find out that there's a problem. But it's similar in Glen Innes, it's similar in Inverell. The smaller communities of, say, Bingaro, I know, has had trouble keeping doctors there as well. So it's not just us, but you know, our situation just highlights it particularly right now.
So look, simply my personal problem, as you know, I was telling everyone that the cost to run this small surgery you see there is anything between 14,000 to 18,500 a week. So that's how much it costs. In my tax papers. And all my taxes counted. My taxes counted electronically, so nothing on papers, and there is no way we could make any mistake. The best cost I ever had was 710,000 a year, and the worst was 965,000 a year. And in that year, I made an extra 365,000 from the vaccination. So to make those 365,000, I spent $250,000 to make those 365,000. So it's crazy, you work like hell, you work weekend, you work Sunday, and then what? Okay, you make a bit of extra money, but you are that exhausted, you're not seeing your family, you're not sleeping, you're not eating. So it was crazy. And currently, even with all this pressure, my hourly take-home money after taxation is only around $40 an hour. But to make those $40, I have to work 70 hours a week to reach that $40. So imagine how much it's difficult for any GP to serve. And I was hoping that, yes, the government will change its attitude, and they are promising with extra money, and that all that was just bluffing and just to buy votes from the cities. All the benefit actually went to the cities and the metropolitan areas. So I don't think any GP can actually survive in the current circumstances. If you had 3 GPs and all the 3 GPs are seeing enough number of patients, and yes, they are making 3 incomes, probably with the same cost, yes, you could. Because if I am spending average, let's say 800,000 a year, if I have 2 more GPs, my expenses will not be maybe more than 1 million a year, but I would be making 3 millions. Instead of making $1 million from all my income, the gross income, I would be actually, you had 3 GPs and everyone is making 1 million. And then, yes, and then you end with plenty of money for everyone. Urala might not be the best candidate for that because Urala is having very specific situation. Urala is too close to Armidale, and many people from Urala are going to Armidale. That's why there was too many people, too many patients to start with in Urala. But the picture is now reversed because people are coming from Inverell, from Bendemeer, from Walka, from Armidale mainly was a big source of patient actually in the last 2 years. So to get a doctor right now, what we can do, it is impossible without funding. Full stop. You can't make it without funding. Don't bother. And don't try, don't advertise. No one on planet will come and buy this surgery or even accept to work as an employee because the way it's going to be set, it is impossible. I myself brought locums in the past and found it impossible because the locum is not going to make much money. The locum will just, doesn't care on the long-term management. So the locum doesn't make much money, but you still have all this expenses on board. Plus, you have to pay the locum. So when the last time I brought a locum on when I had my first surgery in May 2018, and that's it. So when I did my second surgery, I did online. I did phone consultations because I couldn't afford it, not because I didn't want it. So just don't waste your time. And don't believe whoever promised you that we're going to solve it, we're going to blah, blah, blah. This is a lie. Any official who says, yes, we will find a doctor just to shut up the mouth of people. That's it. No one can do it. Don't bother.
So there's no sort of magic rabbit out of the hat, quick fix.
No way. You need to get the money first. And when I say money, you're talking about probably not less than $1 million in the bank all the time, plus an expected of $600,000 extra money you need to pay every year to run the practice and get 1 or 2 doctors. Full stop.
So do you think perhaps then it needs to be more a government runs the practice per se, like the business of it, and just employs a doctor? Would that work better?
I still believe it's the council business. The council refused completely to negotiate. always denied that they are responsible. It's not our job. Well, it wasn't your job, but now it is.
Yeah.
We're going to make it your job. That's it. Because as a council, you are responsible of providing basic services in this town, and this is a part of it. So either the council create an office to deal with this matter, and go to the state government, tell them, well, look, I need that certain amount of money. This is my plan. I need this to buy this land. I need to build a medical center, which practically should be anything between $1.5 to $2 million, because this is the medical center which can survive for 100 years.
Yep.
So we need $2 million.
Your surgery as it is now is too small to really do it properly.
You can start, but you can't survive on the long run. You can bring one doctor. I was functioning, and I still have all the equipments. I'm not sacrificing anything as I promised. So anyone now, even after 1 year, if someone, unlock the door and gets in, will work. So everything is ready to work. You just need a new IT, update softwares and things and security. It takes 2 weeks. That's it. You can work. No problem. Yeah. But I mean to run the job properly, because you need 2 doctors. You can't. I was working like crazy from 7 a.m. till 10 p.m. sometimes. But who can do this job?
Just before we got started, you showed me that map that sort of we're in a zone where we should have 1,100 people per doctor in this kind of region.
So this is what is named the doctor locator. So as you can see, that it is classified as five areas. So the more you go to the metropolitans, or to the shore side, the percentage is higher. You have more doctors there. And as you can see, if we go a bit closer and see where Urala is, so here we have, this is Armidale and this is Tamworth, and we have, of course, Urala and Walka in between. It might not be immediately shown, but we are in the whitish, let's say, or off-white area. We are in number 3. So this determines where the funding determines the incentive. But people may think that this is really something great. And the answer is no, because what I get as a doctor now working in Urala, I get only $23,000 a year as incentive to work in this remote area. If I move to Armidale, I think it's $15,000.
That's even less.
So that's not much. Any locum goes to a hospital and work for a few days could make $15,000. So it's bullshit. It's not something which really It affects the payment for the incentive on the consultation, which I talked about before. For example, if we bulk bill a pensioner or a concession card holder, I would get $35. I think this $35 will be in the purple area, will be $40 or maybe $45. So in the city, it's something like $25. So the difference is not really big enough to attract doctors. Sure. Plus, and this incentive is only on the consultation, and the whole system, which was applied in the 1st of November 2023, was for the sake of getting more votes in metropolitan area, where the doctor actually can make more money by seeing many patients per hour. They can see 6 or 8 per hour, getting 25 each, while I can see only 2 and get 35 each. So who makes more money? Yeah. So the whole system was to satisfy the areas where they get more votes. So it's going to get worse.
You think the city folk have forgotten that we provide all the food and the electricity, and that all comes from the regions?
Well, you have to talk to the government and tell them that, guys, Tell them, guys, you cannot survive without us.
Yeah.
We are few, but we are important. Yes. So.
Well, the last thing we want is like the farmer strikes that happened overseas in various countries. I'd hate to see it get to that level. So if we got say we came up with some way of funding doctors and GP services better, do we have enough supply of doctors and nurses in Australia to meet the need also?
Absolutely. Okay. Duncan, I reached a point before I left, I was getting 1 to 2 applications from overseas who are ready to work. They just need a supervisor.
Yep.
And I am talking about general practitioners who already practice 10 or 15 years in their home countries. And many of them are rural practically because they do everything there, you know, especially from Iran and India. And they are the main best sources of doctors now in the world. So every day now I'm getting an application. My inbox is full with hundreds of them. So we do have doctors. And anyone in my position would supervise.
Yep.
So we do have doctors, and those would not cost much, because when you bring someone from overseas, you pay limited amount of money. So always they do big job for less expenses. And anyone who's coming from overseas, just like me, you know, when I came, I worked the same situation. You would be happy, even if you're not making much money, but you're just started, you know, even if you make $3,000 per week, oh, that's good money, you know. So while you still don't have expenses, you didn't buy houses, you don't have your children in the university. So anyone would be more than happy to come.
Yeah.
Who dreams now to come to Australia? Who dreams to come to Australia now?
Well, for those of us that have, for those that have traveled around, we see what's available in other countries. I'm always very grateful for what the health system here has done for me personally, particularly when I look at what it would have been like if I'd been in the US. But I noted a report the other day about Congo and what's going on there, and like, wow, we have got it so good when you look at how bad it is elsewhere. But you know, you've got to remember that we've got it reasonably okay. We just need to get the finishing touches now and make it, you know, normal GP healthcare be available.
Well, that's what we are trying, of course, to do here, you know. However, we can't just solve it overnight. But I think now what the council has to do is to go urgently to the state government, well, give me $5 million as soon as possible, create an office, put a manager to take responsibility, and immediately you can solve the problem very quickly, but you need to pay enough.
Yeah, yep.
I think the payment for service is the killer of the health service in Australia.
So that's the Medicare model you're talking about?
And even in the hospital for visiting doctors.
Okay.
Payment for service. So if you don't get sick, I don't get money. So what is better for me? You get better or worse?
Yeah, you want to keep them in the system so you get paid.
Full stop.
So what do we do instead of payment for service? What's a different way to look at it?
Pay per hour.
Okay,
salary.
So just pay doctor. Yeah.
Pay salary.
Fair enough.
And here, approximately, you are talking about $600,000 per year. Full stop.
Yeah.
If you want now to employ a GP here, you say, look, the salary for 40 hours a week is $600,000. You like it? You don't like it? Good luck.
Yeah. Fair enough. And then we've got to multiply that by all the major centres around the joint, you know, because there's so many towns in our region in particular that are feeling the pinch on the whole doctor scenario.
Well, look, apparently I was the only one who was bulk billing.
Yeah. Yep.
And as you know, here where I ended. Even all Armidale is not bulk billing.
Well, I suppose one of the things that the people are going to do just by default, and it's going to have to be a wake-up call at some level, is that, for instance, I know that Armidale and Inverell GPs have all closed their books, so nobody can go there. We're going to show up at Armidale emergency room.
Absolutely,
like
and then it becomes state government issue.
Yeah, and you can bet Armidale Emergency doesn't want an extra 3,500 people coming in there. Like most emergency rooms are pretty busy anyway. That would be good.
What I would say, look, Duncan, I'm not an economist, and I'm not a politician. Okay, I'm just a simple doctor who practiced in Australia so far for 16, 17 years, and I have my point of view. I very strongly believe that Medicare must be a state government business. So the state government hold Medicare and the hospital system, merge them in one system, name it whatever you want. Okay?
Yep.
Name it, the health, the primary health network, whatever you want to name it. This system, you fund it by your GST and by increasing the Medicare levy. Medicare levy should be indexed, and even corporates should pay. That's my point of view. You get enough money, and then my dream model for Australia, for Urala, let's say, is to have a medical center with 3 GPs or 4 GPs and at least 6 beds.
Oh, yes.
Because with my personal expertise, I worked in Abu Dhabi. Look, I worked in a private hospital in Abu Dhabi for 13 years. And I became the head of department. Actually, I was the head of the GP and the emergency department because they were one department. Only 10% of the patients we were receiving were admitted. Wow. Only 10%. The accidents, the road traffic accidents, major issues, were going to the central hospital in Abu Dhabi. They were not coming to us. So we were getting the walking-in patients.
Yep.
Which is exactly the model which can work here. So
it becomes more of an urgency department.
Look, renal colics, migraines, twisted ankle, twisted knee, stitching, all injuries, even head injuries, someone with cough and cold and high fever, babies sick, vomiting, diarrhea, all we were handled in there. Rarely we were admitted. Those people who were admitted in Abu Dhabi, those the people whom I would call the ambulance and tell them, yes, this patient needs to go to Armidale Hospital.
Yes.
But other patients...
I believe that the ambulances and the paramedics out there that are the first responders already have a good triage ranking system in place that they use. So if they're working on that kind of scenario, perhaps like the first 3 levels go to an urgency room and then the others are emergency,
exactly,
for lack of a better term. So you're suggesting that perhaps if there was a new clinic to be built, we could have that urgency type capability in town.
Exactly. And when the patient comes, when the ambulance bring it, of course, you triage them. But mainly those people just need painkillers, someone with migraine, someone with vomiting. Yep. If you have someone with gastroenteritis and vomiting, what do you need? What do you think you need to do? You give him an injection of Buscopan and put some IV drip, give the patient 1 Maxolone IV, and that's it. The patient goes home, take a tablet and go home.
Or even if it's something along the lines of,
so when you invest $5 million in a medical center in a country town like Urala, you're saving millions and millions in Armidale Hospital. But when you are dealing with governments who are short-sighted, they just don't want to change. They just don't want to. Everyone is holding his position. I don't leave it. This is my place. And this is what I've been doing, and I will not leave it. No one wants to discuss about it. No one wants to point at the problem. Here you have the most leaked money and the most wasted money in this trashy system we have. We as GPs are in a fight with the emergency departments all around Australia. You do this, no, you do it. And I had many, I have a patient with catheter wants to come to me and to remove the catheter. I said, no, excuse me, no, I can't remove the catheter. Go back to the emergency. What about if you cannot pee after?
Yeah.
Who would put it back? I can't put it back. I know how, but I don't have time to.
Yeah.
And I don't have it.
Sadly, I've been on the receiving end of that in the past, so I understand that particularly very well. So I guess one of the things from government's point of view, and not that I'm there yet, but these all take big picture, big money, but it's also a big time frame. And I guess we've got to get people or government to think beyond just like the next electoral cycle, if you like. It might take, yes, we've got the short-term needs right now in Uralla in particular, but we've got to get people to think bigger picture and longer term to try and make the system work a bit better down the track.
Well, look, as I said, now someone should jump in and take an action immediately. Because what I am doing now is doing the phone consultations. I can't guarantee that I can do it forever. So I am trying now just to help people and to keep doing those phone consultations. But how much I can do on phone consultation? Now you need an urgent action, Duncan. And if the council keeps saying it's not my business, and then Uralla is in big trouble. Yes, I throw back the ball to the council, because the council is the only authority or institute or organization who has the capability to do it.
Right, yeah.
Sorry, you go.
I think the thought I had was, do you look at maybe directly a council project, or perhaps do they have to have their own sort of not-for-profit?
That's a second step. Yeah, that's a second step. The surgery is there. I have the surgery, and I'm happy to just get the rent, which I pay for my super, which is I pay only $363 per week. So that's the rent. I don't want them to pay me for the business big amount of money. The surgery is ready, the equipments are ready, but they need to put a manager, this manager, get the funding, get employees, and get a doctor well paid, and start. Now, second step, yes, you go and buy a land and build a good surgery, which you can expand, make it just a steel frame, so you can expand it, you can change it, make it flexible. And as I mentioned before, you have a perfect land, which is now for sale. We talked about it before. I can show. I can go on the map and just show it quickly. So the land is there. Everything is there, man. It's okay. So let's go back. Okay. So here it is. So that's the dreamland, which I always thought could be a perfect solution. Okay, sorry. Where are we? Here it is.
Yep.
Yes, just behind. That's the 32 Queen Street. This is the perfect land to have a medical center and plenty of space, plenty of parking. And the other land, which, if there were few lands to be suggested, there is one here in Salisbury Street, but that's a bit small.
Well, I did note the other day that block next door to 32 Queen Street is now also for sale also.
Yes, but
so
that's
that
imagine
whole green there.
Imagine if you sorry, it's here. Imagine if you can take the whole lands here to the creek. Yes. Yeah. And the other possible land is the one in in that's Duke Street. Where is the? No, in East Street, just at the end before the creek. Sorry, I didn't think that I would need that. Yes, here it is. Here.
Well, there's plenty of options. A number of options.
See this one in. See how huge. And actually, it's very quiet area because the East Street here hits the creek here. Okay. So this is very quiet and huge, and you can even future-wise, you can build a doctor accommodation. While if you compare it, it with my land, with the, how big is my surgery, and just for so here is my surgery. So that's my surgery.
Yeah.
See how big. Small? Yes.
Yeah.
And even in
it does
behind
limit
my
your options
surgery,
to have something bigger.
Yes, but even in my surgery, even without removing the building, the old building, you could still build a small surgery, which I showed the plan before. The plan was only 155 square meters. Less than $500,000, you can actually get a surgery, but give me the funding. However, look, Duncan, we already been talking for half an hour, and as we promised, we will allow people to come on the stage.
Sure.
So what I'm going to do, I will put the link of the StreamYard. Here it is coming. So when you click on the link, you can come inside the studio. You don't need to log in. You just need Chrome in your mobile or on your computer if you like to talk and ask questions. I see that many comments, but I can't really catch up with the comments.
And what we'll do is we'll look at the comments later on, and we can answer them, in the follow-up.
Yeah, so it's better to have maybe just face-to-face discussion. If someone wants to ask questions, we are happy to discuss that. We could sit maybe another half an hour listening to questions if there is yeah, here we have a good comment. Yes, the council needs to get the money from the state government for sure.
It certainly seems to be a big hurdle when you've got two different levels of government, both funding different parts of the health system. It seems
a mess.
Well, a mess. Yeah, you wouldn't want to run a business other than health. Like, how would you do that if you were trying to run a private business of anything, where you've got one level bringing money in and spending money out, but then the other person who's trying to operate on that money has to try and jump through all the medical and the administrative hurdles, and let the doctors just be doctors and let somebody else who's more of a business person. As you might, I don't know if I said, I'm in Sydney at the moment. I'm back on tomorrow. I've met up with a former colleague of mine who's worked in the private health and private hospital space as well. And he's was the chief operating officer. So he was not the medical guy. He was sort of what we need. He was doing the operations. So we probably need that on a smaller scale.
Yeah, this question from Wendy. Yes, Wendy, we talked about it, I guess, if you go back with the video. And another question quickly. No, it is different from the joke of Kevin Rudd about mega clinics and stuff. I don't think he really had any idea what he was talking about. So no, and that's why his system failed completely. This is another bluffing idea done by Kevin Rudd. So we have Stuart. Oops, Stuart is off. Sorry, Stuart. Stuart was waiting and went off.
When I was in Inverell the other day, I went to visit the hospital up there, a brand new flash-looking hospital. It looks pretty good. and there's an urgent care clinic literally just as you're walking down the path to go to emergency. And I thought, oh, that's good. They've bothered to do that to sort of have a separate area. Anyway, it was closed, and I asked the ladies inside at the admin desk, I said, what's going on? And it's like, oh, we can't get enough doctors to do it. And it's like, well, that sounds familiar.
Okay, we have Carl. Yes, Carl, you have 3 minutes if you like to ask questions.
Yeah, I know maybe some of us who have thought that the Medicare clinics, that'll make it a lot better. But I did speak to another rural doctor who explained that the amount of money being offered to the doctors who work there is, so much more than can be paid in a regional area, and they're overwhelmingly in the cities. Like, even if there's one in Tamworth, like if you live in Glen Innes or Inverell, that's a long way to have to go. If your doctor leaves Inverell, leaves whatever town, works in Tamworth or works in the city, that's maybe an area that the current Medicare clinics are actually making it worse.
Well, look, again, when it comes to the funding, currently they are, if they want to bring a doctor to the rural areas, I'm not sure how much they are paying exactly. But as far as I remember, I heard that they are paying $3,000 per 24 hours for a locum to come. But those doctors are actually working in the GP system and the hospital system in the same time. So the model doesn't work because still, as you said, still the doctors are making more money in the city. And what the federal government has just done in November, actually, they put more money in the city. So how can you convince more doctors to come to the country? And actually, what I can see, that more doctors like me will leave to the city because they can make more money in the city. Does that answer your question, or I didn't get the point?
Yeah, I'm happy to leave it there. Yeah.
Okay. All right. Thank you,
perhaps
Carl.
What we've got to get. Sorry, Carl.
You go.
I'm just thinking out loud. The chance then is that if we can, because it's so raw right now in Uralla, if we can get it to a point of whatever we come up with as like a pilot program to test it in Uralla, and come up with a model that we can make work, then it could be something that then could be very much looked at in other regional centres.
Exactly.
So
exactly.
You can roll it out. Here's it's almost like a McDonald's franchise plan. Here we go. We did it here. It worked. Just do that.
Exactly. Okay, Stuart, you can talk, Stuart,
Hi,
if
Stuart.
you like.
Hi, Ricardo, and hi, Mr. Fisher. I've got a simple, basic question.
Can you raise your voice a bit, Stuart? I think your voice is very low.
Well, I'm losing.
Okay. It's off.
He'll be back.
Okay. All right. Okay. Okay. So if someone, I will just put the link again. If someone missed the link.
Well, I'll throw one question out just in general. Almost the people that are listening, the people that are watching the live and commenting, etc. Do you find this helpful to be able to listen to the discussion around these type of topics going forward? Should I be elected? It's one of the things. I'm a bit of a nerd, so I like the technology. It's always a good good question to ask is how best do we get this information to people? Live video seems to work pretty well. It's kind of like a talk show.
Without posters. Without posters.
Yeah.
Without putting rubbish on the walls and the trees.
Yeah.
Sorry for the word.
Oh, that's a sore point for me. Like, I've got my posters ready to go, and we're actually not supposed to put posters anywhere on public land. It's in the handbook.
Yes. Yeah,
but it's kind of accepted that it's okay because everybody does it. And I always take the position, well, Just because everybody does it doesn't mean it's right, or doesn't mean it's allowed. It just means it's ignored in this case.
Well, I guess the way to go is the digital. You go digital, no papers, no prints, you know.
Well, I'll still do some printing. I've got a big print job to do. I've got how to vote cards coming up.
Yeah, well, you can't avoid 100%, that's true. But I mean, you know, how to communicate with people and listen to people, I think this is the way to go. You know,
yeah, I definitely want to.
Yeah, you can use the StreamYard system. I used it actually for a while now, for nearly, nearly 1 year. StreamYard, yeah, it works well. As you can see, you know, you can share, you can, you know, show your plans. And even if you have a window or slideshow, you can do a lecture actually on, and you can broadcast it to your channels. Yeah, so it works very well.
So we're going out live to 5 channels, I think, at the moment.
Yes. See if.
Sadly, it wouldn't do it directly to my Facebook page for the thing because the Facebook page was so new.
Yeah. So we have Louis. Okay.
Hello, Ricardo.
Yeah, I agree with you, Peter.
Hello.
Ricardo, I wrote to the Federal Minister for Health, when I learned that you were going to close your practice, and I got a reply back. And I have a few. This is without notice, I realize, but I have a few questions to make about that. For instance, first of all, they say that in private practices like GPs, which are private businesses, that's what they say, they make commercial decisions, how you operate, who you employ, and where you locate your business. So that's what you're doing, obviously. But there are incentives available for what do they call them? MMs. And apparently Urella is an MM5, which is a modified Monash model number 5, and it's geographically remote, so there is more support available than accessible areas. Is that clearly that's not, as is evidenced by your departure, that's not sufficient to keep the practice running?
Look, we squeezed the very last drop out of Medicare. Believe me, we tried our best, and Rennie been working on that all the time. You know, we don't miss, because every time they have a grant or they have any system, no, Louis, it's a waste of time and just a band-aid, and they just tell you, yeah, well, that's a private business and they make their own decisions. So I am wrong. I was wrong. So that's what they are telling you. Now, yes, I made the wrong decision, wrong financial decision. Okay, thank you.
Yeah,
that's what.
I thought that was a bit of a fobbing me off a bit, because it's clearly not a private business. It's an essential service. It's not like a McDonald's.
They are brushing it under the carpet. That's it.
They mentioned. Can I ask another question then?
Sure.
I forget if I can just check the name of the person who answered on behalf of Mark Butler. It was a fellow called Matthew Baltus, Director of Workforce Distribution Branch of Department of Health and Aged Care. So, but he says, I understand that both the local rural RWA, I'm hoping that you know what that means, the Rural Doctors Network, the RDN, and the PHN, the Hunter, New England, and Central Coast Primary Health Networks, they're all aware of the situation in Urella and are working closely with the practice and the community to ensure patients are supported. Is
bullshit? Shut up, play away. Bullshit. Yes, working with the practice. I don't want to say something dirty here.
So you have.
Sorry, Louis. No, bullshit, Louis.
No, I'm just reading what I've been sent.
Yeah. I will not tell the name, but how I announced it. Of course, the first 2 persons who knew were the manager of McMo Garden and Caroline, of course, because those are working very close with me. So the moment I told the manager rang the council. Someone from the council came running, shocked. I said, well, it's too late. And then, of course, they informed the primary health network, who practically, sorry for my French, shitted themselves when they heard the news. And a very gentleman, actually. He was very helpful person. He rang me and he was, nearly crying. I said, well, yes, that's what's happening. And sorry, but that's it. Yeah. That's it. No one from the council talked to me. No one from the primary health network talked to me, but that gentleman, I don't want to mention his name. And no one even from the Chamber of Commerce in Urala. No one even asked me in the last 2 years, well, Ricardo, we knew that you are in crisis. How can we help? What do you think we can do? Yeah. No single one, Louis. No single one talked to me. Full stop. And whoever says anything else, you are a liar. Yeah. You are a liar. You are just bluffing people. You are just bullying shit people. And that's it. And I challenge anyone to say that he or she talked to me. Never. So it tells you, they are working together. Yes, we are working together. What? Bridge? Poker? Come on.
Maybe they're talking to each other down in the various networks, but not getting to the actual, boots on the ground type level.
Did anything ever happen, Ricardo, after the last crisis when you had the public meeting at the bowling club? There was I got the impression that somebody, was it Richard? I forget his name.
Yes. Richard. Yeah. Look, he did his best. I didn't think the community was able actually to do much, because without funding, and we wanted to take the 32 Queen Street. That was the plan. Of course, the owner is a businessman. He needs confirmation. He needs warranty. I totally understand. They tried their best without really an intervention from the government. It was too late, and I kept my mouth shut only because Medicare kept promising, and I thought, yes, the new system could work. But then, sorry, I found that's all about funding the metropolitan areas, and we were left behind. And now they are coming. Now they are coming with a new system, but I don't trust them. Now they want to cancel the management plans and stop this part of payment, which is not less than 20% of my income. And they want us to prove that you are sick and you have that much chronic diseases, and you come to the surgery every year, you sign a piece of paper, and we scan it, put it in the system for them, and then we register you and keep registering you every year. I need a new employee for that. Yeah. And now, just like the same system of the closing the gap for the Aboriginals, and we keep chasing people here and there. And of course, first year they paid good money, and now they shrunken the money. They paid me, I think I got $75,000 first year, and now it's only $25,000. Yeah.
That's a big difference.
And Rennie is sitting all day chasing people, trying to book them to come to see Pam, because you have to do Aboriginal health assessment for them. And you find yourself at the day chasing your tail and spending more money, and you need more business, more work, paperwork. And for what? For $25,000 a year. I'm talking about $900,000 expenses. Yeah. It's very frustrating. Can I?
Doesn't add up, does it?
My last question, if I may.
Sure.
Thelma, I've got a heart condition, and there are no doctors in the neighbourhood. I'm very appreciative that through telehealth I can keep at least getting blood tests and things like that done. I hope.
Yes.
But what after the year? What do I do then if I haven't found a doctor? I'm fairly
Look, I can practically do it forever, but of course the missing part is the examination. If I have to listen to the chest or the heart, and then I start guessing here. The other option is to refer the patient. There are some GPs whom I can connect to. It is difficult, but I can still do the blood tests and things. You can check your blood pressure with your own machine, email it to me, I give you a ring, we have a chat on the phone, and I can even make management plan on the phone consultation. So I can send you updated management plan. That's what I'm planning. But the challenge in it, I'm going now to not a very busy practice, but that's only in the beginning. I might be seeing 15 patients a day only. But if it gets busy, what to do then? How much I can cope with that? I don't know. Seriously,
Okay.
That's the problem.
Thank you very much, Ricardo. I know there are other people on the line, so I'll bail out.
Okay. Thank you. Thank you for you, Louis. Thank you. Okay. Well, sorry, Sue disappeared. We made her wait for a long time. I apologize, Sue. So I'm putting the link again if someone wants to click on the link. Yeah, good question. See the.
Well, that's exactly I'm in the same boat. Like a year from now, I've got my referral to my GP, to my specialist, but that's got to be renewed in a year. So,
yeah, well, that's what I can do. I still can't do it. Your specialist is on electronic system. So I'm taking the, of course, the files with me. And still there are two systems which I'm not sure if they can be installed in Queensland, which is the hospital referrals and the driving license. And
so will you go on to into different, because you're going to a different state, will that affect things for you, because now you're going to have to deal with two different state health systems?
No, not necessarily, because if you install it in the software, you still can access it. But
okay, cool.
I didn't want to put too much pressure on the surgery there.
Yeah.
So I'm waiting to go there and sit with them and then log on, my account here, the surgery, tell them, guys, I have those two systems needs to be installed, because even the ACAT, for example, the aged care, assistant for people, so those also, that's electronic. So, but the driving license is the main things. And then if you want your driving license to be done, you just need to get me a report from the optometrist, because that's a missing part. I can't examine the eyes. So the moment I have a report, and then I know your medical conditions and stuff, and I put it online, just as usual.
So I guess in the very short term, would something like a nurse practitioner or a nurse at some level be somebody that could do the eye test and be there for the blood, like the blood pressure test and those kinds of things?
I'm not sure if it's legally possible in the first place. A nurse practitioner would do the job, but the next nurse practitioner, of course, it's a very good solution, and it was suggested in. That's another example, actually, just to give you an example how the government thinks. Okay, McMo is thinking to employ one of their own nurses to train her as a nurse practitioner, and they're gonna get funding from the primary health network for that. But the primary health network put a condition on it that she has to also serve in the community. Right. So what it meant that I told them, well, congratulations, this doesn't help me in any way, because this means your nurse has to be employed by the primary health network, and you have to hire her from them. So a nurse who's working full-time in McMo, and no way we could give her up, because she's the main nurse. She's doing the whole job, So no way we could actually give up her role. Would be trained and funded. The training would be funded by the primary health network, but she has to serve in the community. I said, no, I'm saying the council should employ a nurse practitioner for McMo only.
Yeah.
Stop it.
What exactly does the primary health network do? Like you mentioned that. Where do they? What's their structure?
Okay. Those replace Medicare local.
Right.
So it's a sort of organization was created, as far as I remember, by Tony Abbott, to liaise and connect and help, and they are doing good job, to be honest. I can't complain about it. They are helpful, but my understanding that they are funded essentially by Medicare through the state government, so they still do some business together.
Yeah.
For example, when they did the vaccinations, that's a big example. When they did the vaccinations, the COVID vaccination, the vaccinations were coming to the to the federal government, and then going to the state government through Primary Health Network. So Primary Health Network was the organization which was looking after the distribution and the organizing stuff like that. They are helping, of course, but still, it's one of the examples that you need to merge the systems together.
Yeah.
And this is what Mark Butler is telling you by his officer, whoever it was, what Lewis says. Yeah, this is a private and they make their decision. So it's blaming me. Full stop. Blaming me not to save money. Yes, but when when I make a small mistake like that, you crucify me.
Yes.
So look, it is pity. It's very frustrating. It's very frustrating. So I don't know what to say, seriously. Anyhow, look, guys, if someone really wants to come and ask questions, I can't catch up with the comments, especially that I'm trying to answer questions in the same times. So if someone wants to come and ask questions face to face, will be welcome. We still have a bit of time. So, Duncan, so that's your big mission, Duncan.
Yes. And I think it is something that's always been close to me, and I can genuinely say I started working on a solution. I spoke with Caroline, and for those that don't know, Caroline's our pharmacist in town. I had gone to her initially because I have friends in the health space elsewhere at various levels, and sort of broached the idea of what do we need to do from the pharmacy's point of view. Could we have a telehealth sort of set up there or something? And she was very open to whatever solutions we could try and come up with. And then lo and behold, like within a couple of weeks, here I am putting my hand up to run for Parliament. So maybe I'll have more influence down the track. It's less than 2 weeks away. We'll find out whether I've got what it takes.
Well,
either way, it's a primary thing.
Look, Caroline would be maybe one of the biggest victims in this, chaos, let's say, because of course I have to thank her for her patience with me, and she was very happily willing to provide injections. That's a big problem, by the way. Not only vaccinations, also we have the Prolia injections, we have the B12 injections, we have lots of vaccinations. And so we were even thinking to move one of my fridges to the chemist, not to sell it, but we can move it for free if she wants to use it for those injections and keep the service running.
Yeah. Well, that's good.
Well, she's trying her best, Of course, she's paying a high price of the Mark Butler planning, with the 2-month scripts. I'm afraid that if she starts receiving more 2-month scripts, it's going to be a huge financial pressure on her. Unfortunately, the doctors in Armidale are doing it. And as you know, I advise against it. I said I'm not doing it, because for any GP to do that, you will be, that's my message to the GPs, you will be stealing the money from the pocket of the chemist and put it in yours. That's it.
And
so
we see that highlighted in Uralla as we just have one pharmacy, and that's another lady in this case in the community that lots of people know. And I'm sure that'd be the same in just about every small community and larger communities.
Absolutely.
I mean, in Armidale, there's a choice of pharmacies, but we've got one. I'm pretty sure Walker's only got one.
Yes.
We could rattle off lots of towns that some would be thankful if they just had one.
And you know why they are surviving? Only because they are on the highway. Full stop.
Yeah.
Now,
and the jelly beans at the front counter.
Exactly. Yes. If you move the highway out of Uralla, the pharmacy is dead because there's not enough business.
Well, that's another story. As you know, I had a business in the main street years ago.
Yeah.
And not good as the diabetic to be having the lolly shop, but I noticed even then that we don't ever want the main street bypass like's happened to Gyra, for instance. It's just it would kill all the local businesses without that traffic.
Exactly. But even in Walka, the same. Only because they are on the highway. People stop for the stuff. And I think, I didn't ask, but I think they could be getting something like 20% of their business from the highway. Not from us.
I used to work on 50% of my business was just people that happened to be driving through town.
Yeah.
So I'd ask all the time.
So imagine if you add the pressure of the 2 months scripts on them, it's a big money. Caroline told me when the crisis happened last year around this time, if it was applied to everyone, you're talking about not less than $130,000 loss in the gross income. How could she survive?
It's a big hit.
No way. She would shut down next day. She better go home. You know, she better sit at home on pension, you know, or unemployment, whatever you want.
I don't think she's old enough for pension. You better not go down that way.
Yes, yeah. So find a way to get some money, you know. No way she could run a business. No way. You're talking about that's hardly enough. Such business would be hardly enough.
And it's not just her as the pharmacist. She employs, 3, 4, 5,
many
probably
people.
6 other people that work there.
Yes.
Plus, there's a locum pharmacy, Amber, that comes in from, she does Walker and Uralla. So she fills in the gaps.
So imagine,
they're all very
imagine
important.
what would happen. Absolutely. Absolutely. How can you run the economy in Uralla without a GP and pharmacist, and then you find the council telling you it's not my business?
Yeah. Well, we've got to make you're currently it's not, but we need to make it their business.
Exactly. Forcefully. Yes, forcefully. They like it or they don't like it. No, it is your business.
Yeah.
You can resist as much as you can. And I'm saying that in advance now for anyone who comes and says, yes, we are doing, and no, you are not. That's it. Yeah. No one is doing anything. No one approached me. No one talked to me. And no one cares. Full stop. Okay. And you are the only one, Duncan, who came and said, Ricardo, we want to talk about this. That's it.
Yeah. That's amazing.
No one wants to talk about it. It's not the business of anyone. They tell you about wind farms, solar farms. You know, I don't know. Yes, I know that there are many issues to talk about, but what about this?
And I see that variance is that they seem really good at spending on capital expense. So we've built a thing, we've bought a thing, and here's the wonderful thing. And it's easy to have a big win because, hey, look, we've got a new whatever the thing is. And we've kind of lost track of the people where yes, it's more complex to deal with people, of course. But if we haven't got the people being looked after, what's the point of having the flash new whatever? The flash new hospital's not much good without doctors. I was saying to someone the other day, and it might be a dated reference, but I'd rather be treated in the MASH 4077 from the TV show, so in a tent in a war zone with a doctor, than in a brand new flash building that doesn't have a doctor. At least you get treated.
Yes, we got a brand new car, but we have no petrol.
That's it. Pretty much.
Yes. So anyhow, any further question? I think no one is interested to talk anymore. We apologize for the comments. Maybe Duncan, you can go back and answer the comments one by one later.
Sure, I will do as much as I can.
Because I guess mostly they came on your website. There are actually a few on my, you can do it also on Urala Medical Center.
Yeah.
You go through tonight, you have a long night, maybe answering questions and chat to people. And yes, Duncan, I fully support you, and I'm very happy you jumped in and raised this matter.
It's been a good ride. I'm learning quickly, and I'm tired,
Yes.
but it's a good tired. I'm doing stuff that matters, and it's amazing how much that energizes you.
Exactly. All right, look, we will end the stream here.
Yep.
We did more than 1 hour. Okay, if you stay with me, Duncan, please, I will tell you when we are offline. Thank you, everyone. Thank you for everyone. People who came. And thank you for the people who came online. I apologize to Sue again. It looks that we were late to take her in. And we will end the stream now. Have a good evening, everyone.
Good night, all.